Heroes, they come in all shapes and sizes. This time I sat with a hero without scrubs. You heard it right. The hero without scrubs.
As you say, I don't talk much about it, but then I let it go. I was like, okay. And after that, I got an opportunity to submit our paper to Radiological Society of North America. And me and my co-lead, we went to Chicago. And Stella, I was 6 months pregnant, and I had a lot of complications.
Oh.
And I had to do an ultrasound every 2 days. And in my head, I'm thinking to myself, I have to go and present this, because I was the only hospital from East Africa presenting on that platform.
That is the reality for one Uzma Qureishi. On this episode, I sat with the hero who does not wear scrubs, but transformed a whole healthcare system. A woman, a champion, and best of all, the lady who ensures that the patient care at hospitals is at the heart of every digital transformation. A lady who understands the importance of the subject matter expert. She had to sit with surgeons, to devise and design the requirements of this technology platform. And she did it whilst grieving, raising her children, being herself, and she still has a smile, because for every hero without scrubs, it's always about the impact. A lady who won a CIO 100 Gold Award, was a finalist for the CIO DX Nova Award, and was 2025's top woman in digital transformation. Tune in, listen to the episode, and let us know what you think. That's it from me, Stella Gishuhi. Miss Uzma.
Hello, Stella.
Hi. I'm so happy you're here with us today.
Oh, I'm excited to be here, and it's an honor. Thank you so much.
Uzma, what can you not do? You're championing women in health. You're fighting for patients and their records in health. Guys, if you do not know about Uzma Qureishi, please go read about her. But let's get into it. What inspired you to get into health tech?
My background was not even in healthcare tech.
Oh.
And my mom was diagnosed with cancer, and she was admitted in hospital, and I was studying in Australia, and I came back.
Okay.
And I literally used to live in the hospital, with her.
Oh.
And that's when I realized that, I feel like being here. I want to be part of this. I want to change a few things. And I think from then on, I just felt like this is where I belong. And I come from a family that I feel like, seeing my grandmother, my aunt, my uncles, my mom and dad, always helping.
Okay.
And I wanted to change people's lives, but I didn't know how, and how can I do it? And when I got this opportunity to implement, it was a legacy system at the Alcan Hospital at that time. Yeah. And when I got that opportunity to be part of that, I saw how we could change. We were implementing a project.
Yes.
We were, creating process flows, but at the back, we were touching a human life.
Yes.
And when I used to come home, I just used to feel so content that I could do something. And I remember a process I changed in lab. And my mom was one of the patients that actually benefited from that process. Wow. And that was what was my starting point.
So you're driven by impact.
Yes.
For you, it wasn't just about the salary, the big title. They're good, they're cushy,
yes.
I mean. But for you, always has been, always will be impact.
Impact.
And how have you seen health tech transform and change over there since you started until now? And when we're talking about health tech, there's now the system side, which you're very conversant with.
Yes.
And you're the boss there. And then there's now telemedicine. And then actually, point I want to raise was COVID. How did COVID transform work and life for you guys?
Wow. Yes, I remember those days. I remember that, when everybody was focusing on the clinicians and nurses and saying, you're heroes to going to the hospital. Exactly. But at the back, we also had to get to work. And we had to make sure that the systems were on for the clinicians to work on and, provide that treatment to the patient. So COVID really, I think, made us stronger, because we looked at how can we make this less paper. Like we don't need to have paper because that time even holding a pen was infection control. Let's not have this.
Yeah.
So we started brainstorming and saying, how could we make this more digital?
Right.
At the time when COVID actually struck, I remember I was in Dubai having a conference on the EHR we were implementing.
Yeah.
And a few of us got sick on the plane.
What?
And that was the start of COVID. And we had no idea. And it was also the start of our huge EHR implementation. And I remember we had to, in no country has an EHR being implemented like we have these dictionary building.
Yes.
It was just a blank canvas given to us, and we had to build our dictionaries. And when I say dictionaries, that meant clinical and non-clinical. The team had to come down from the United States and South Africa to help us do this. Now COVID struck.
Whoa.
And so we had to completely change the whole implementation project and say, okay, we need to do this online. So I think I have to give it to our teams here.
Yeah.
The local teams were amazing.
Yeah.
We got together. We some of us used to, a few days be at home and then come to work.
Yeah.
And so I would say that we're heroes without scrubs.
The heroes in health without scrubs.
Yes.
I like that. Wow. So 6 years later, there's been change, there's been transformation. Then there's this, and there's this tech. I don't know, it's not even tech because that's my space. AI. AI is disrupting life as we know it. But we're not giving it the spotlight or the conversation or the highlight, whatever you want to call it deserves in health. What are your thoughts?
I agree, Stella.
Yeah.
There is a lot of hype about AI in the health sector.
Yeah.
Personally, I really want... AI is already there.
Yes.
We're already seeing AI. Like, for example, we did a pilot run of AI in our radiology department to see how AI can, read our x-rays faster than, a radiologist can. But of course, the radiologist has to, read through it and authenticate it.
Yes.
So AI is already there, and there is some component of AI in our EHR, which is the Meditech Expanse.
Yeah.
But, implementing AI in healthcare is not just like implementing AI in any, like a bank or any,
it's not.
Organization like that.
Yeah.
Anything we implement touches a human life.
Exactly.
So we have to be really, really careful. And that is why, we get so many vendors coming in, saying we have this AI platform. Would you like to see it? For me, I feel like it has to be ethical.
Yeah.
We have to align with the Data Protection Act of our country and governance. It's really important. So I think looking at all that, I feel like AI is going to come. It's going to help our clinicians, definitely. It's going to help our operations. It makes life easier. But we have to be very cautious, especially in healthcare.
I want to touch on something because I champion AI, but last month, an AI model went dark. We'll say we went dark. We couldn't access Fable Mythos. That's Claude, right?
Yeah.
Then they went back online. And a question I had with another guest was, what if a hospital, now you're here, what if you built a system on top of a model that you could no longer access?
Wow.
What would that look like?
So I'm so glad you asked this question because, I feel like there are healthcare workers out there that want to create their own AI platform. So there is this AI tool, say Claude, and they can make anything.
Yes.
Okay?
Yeah.
But this is what we want to go out there and educate, that it's very easy to use an AI tool, but where is this data being stored?
Yep.
The security of this data?
Yeah.
Just as you said, the downtime. We are so particular at the hospital that we have backup systems when a system goes down because, again, it's linked to patient care.
Exactly.
So you have all the, like right now we are paperless, so everything is on the system. So when you have an AI and you are creating something and you have no access to their back end,
Exactly. Yeah.
they go down. you're down as well.
And your patient is compromised.
And for us, that is why we, sometimes the healthcare IT department is somehow looked at as maybe a showstopper or a roadblock, but we're not that. We're just trying to be really cautious. So what we want is that you want to have an AI tool, yes, but we have to ensure that it goes through global security assessment.
Of course.
It's key, and we pass it through our legal department.
There are certain industries that you have to be extra vigilant.
Yeah. We're in such a critical, I would say the organization is we have patients' lives there that we have to look at. So anything we implement, that is part of it as well. Yeah. So I feel like, when we want to implement something or when we're looking at AI tools, it's not that we don't want to do it. We advocate for it. Yeah. We want it. It's going to make our life easier as well for IT, know.
Yes.
But that's why I say that we need to do it ethically.
Yep.
We need to look at governance and we need to look at the data protection of the country that you are operating in. Yeah. A lot of people come and say, we're GDPR accredited, we have HIPAA, but we're in Kenya.
We're in Kenya. It has to be context specific.
It has to, exactly, so we're in Kenya. So we need to look at what our data protection Act says.
When you say we, is it the vendors who need to look at it, or is it the hospital at large? Who?
Really good question, Stella. I love that question. You know why? I think both.
Yeah.
Vendors come to us and they go, they take us through this whole AI platform, and then just to realize that the data is going to be stored in cloud. Oh. And where's your cloud stored? Somewhere around the world, Dubai, UK, US, and that is already, you're not meeting the data protection regulation. And so I feel like vendors need to align with that first. And for us, Stella, data is so key for us. It's patient data.
Care, patient data. If there's a leak, I'm coming for you. No, it's true.
Exactly.
In this day and age where, you post a photo of a club reveler without their consent, that's the ODPC on your case. 1.5 million, 500,000.
And ODPC is very, very particular when it comes to healthcare.
Yeah.
We have to ensure that no PII, that's patient information, goes out. Yeah. So that is something that we have to really take care of. Uh-huh. And I am proud to say that, with our legal teams at the hospital and our security teams and us and IT, we are very careful about that.
I like that. You're very passionate about this. Have you ever had observed an instance where you've implemented, you've spent all this money, hoorah, but nobody's utilizing what you've implemented, or it's not working?
So luckily, I think in the right now, currently, whatever I think we must have learned a few lessons.
Yeah.
In the past, okay, when we had our legacy system.
Yes.
Very old, okay? And because our legacy system was not a fully integrated system, we got different standalone platforms to integrate with the legacy system.
That must have been a headache.
It was chaotic.
Whoa.
And that was the reason why we took the rip and replace strategy of saying we are shutting one down and we're switching on the other. And that was the biggest step we took, but I think it was amazing because of this. And so I feel like that was there was a high cost, right?
Yeah.
You're integrating every standalone system with a system that is not fully integrated. So I think learning from that, we decided, and I was really blessed to be part of the EHR team when we started, because it was our late chancellor's vision to have all his hospitals on one platform. Mm-hmm. And so I was part of that journey, and we went to different countries around the world, and we saw, the top EHRs around the world. That's when we realized that we need to get a fully integrated electronic health record system. Mm-hmm. Mm-hmm. Meditech Expanse, our vendor, was just saying that we are the only hospital in the sub-Saharan Africa that has integrated it fully with many integrations. And when I say many integrations, you have SHA.
Yep.
You have all the biometric, corporates. So we have a lot of integrations. But when it comes to the clinical, we are fully integrated, and also non-clinical, but look at the finance and all that. So I think we learned our lesson with our legacy system, and we were very careful about what we wanted. We actually, I think we knew what we wanted, and I think that was very important.
And you led that transformation. You're not mentioning that you led that transformation.
Being a woman leading
exactly.
You know?
So it's in your head.
Yeah, I think I was really grateful that I was given that opportunity and chance, by the leadership, and that is where I started my growth. I think I was passionate about this project.
And you still are.
And I was, I worked on this project since 2010.
Wow.
Yeah.
And when did you go live?
2022.
Oh, wow. 12 years.
12 years. And I think this time why our implementation was so successful is because, I remember because of COVID, we didn't have support from the outside world because there was no local benchmark. We were the first hospital in East Africa.
Wow.
And so they couldn't come. And I remember the day we went live, we created this command center. And I remember I was given a blank canvas and said, we need to do this command center. And I thought, okay, where am I going to start? Right?
Yeah.
And we had 157 people in that command center. We had different professionals from different cadres. We had physicians, we had pharmacists, we had billers, we had stock inventory, we had nurses, and I loved it. Like, I still remember when I looked at the command center, and I remember looking at it and saying, oh my God, we did it. I think because when we started this implementation, we had it from... It was not just the leadership making the calls. We had the stakeholders engaged from the ground.
From the onset.
Yeah, from the onset. Wow. And it did not matter what your position was. Everybody had a voice.
They mattered.
So they mattered. And I think that was me. I used to go down on ground and be like, okay, even somebody like medical records who would their job was just to pick up the file, run to the ward, give it to the doctor and come back. But they're important.
No, so it's the people factor again that we keep stressing on. People are at the center of every transformation.
People are that's why I keep saying that any implementation you do, any technology that you bring into your organization, people are at the back.
Yeah.
So it should be people-centered. And if you don't bring your stakeholders in, you don't bring people in, nobody, that implementation will not be successful. No. And I've seen that in very many other hospitals, that you don't bring people, you just come there and say, this is what you're going to implement, this is what we have.
And it blows up in their face.
Yeah.
So it took Aga Khan University Hospital 12 years to implement one of the best integrations in this part of the world. Integration sounds easy, but based on your experience, 12 years, you've transformed a whole system with Aga Khan. You're being forced to integrate with a system that does not have the best PR, right? What lessons have you identified that you'd like to apply to this integration journey? No, and not just Shah. I'm just being cheeky here.
Yeah.
But we're talking about Shah. What would you say, guys? Don't even go down this path because it will blow up in your faces.
So I think the first thing is you need to the requirements, the gaps. What are the gaps? What are the requirements? Stakeholders. So whether you want to implement it with the private sector, each private hospital has different processes. Yeah. It has different EHR systems. We're the only one who's got a fully integrated one. Okay. But there are other hospitals that also have, their HIMS, their hospital systems. So you need to know it's not just black and white. No. It's not that, one integration is going to work for all. Okay. So that needs to be looked into.
And capacity. Going back to the people factor, I found that 2012 project management, NHS, then to me it was very straightforward. But now when I look back, I think to myself, wow, you do need subject matter experts who come in from health, right? Project professionals, implementation professionals, testing professionals. Oh, yeah. Do we have that capacity in country? Or do we need to champion more health tech focused resources?
I feel like it needs to be championed.
Okay.
We need to go out there and talk about this, because I feel like when we went live with EHR, none of us knew this.
Yeah.
And when Meditech Expanse gave us the project plan, I still remember the requirements. They said, okay, so which doctors are going to be part of this project implementation? And everybody was like, doctor? Really? A physician, a consultant, a surgeon?
Yeah.
You need a surgeon to be part of the build? Yes. It's a mandatory requirement. And that was change management.
So for them, this is purely tech. You don't need the hospital side.
Yes. Okay. And this is what we were trying to, this is what I always say, that EHR is not an IT project.
No.
It's a people's project. Yes. It is it's the organization's project.
Yeah.
Everyone needs to be there. So Stella, I love your question and your point on this, because, I love the fact that I love this conversation because I'm talking to somebody who's read the book, okay? And you know the background of it. So when they came, we had the experts from pharmacy.
Right.
So the pharmacists did the build.
Yeah.
Even though our teams, like, the joke is that, at work they call me Doctari, and I'm just like, I'm not a doctor. And they're like, yeah, but Uzma, so much clinical knowledge, And
you're a subject matter expert.
Yes, and I had to learn that. We had to do order sets, and I had to learn, what does a pancreatitis actually have? Like, okay, these are the radiology tests need to do, these are the labs.
What are order sets? Sorry,
so order sets are, so we went with this company called Elsevier. Yeah. And order sets are, for example, you come and you say, I have a pain, and you put it into the system.
Oh.
And what we'll do is, the system is smart enough to say, if you think it's a pancreatitis, or you think it could be appendicitis, we have an order set for it. So you click on it, and you don't have to go there now and say you need to do these tests. All the tests are already embedded into it. So the doctor just goes and clicks on that order set. But who created these order sets? It had to be our physicians, our surgeons sitting with us. So our surgeons had to sit there. And I still remember, he was a really good friend of mine, Dr. Karan, and we were sitting, and I was doing the order set with him for surgery. And I learned a lot, I remember. And he was literally sitting there and ticking, And so you would never think of a surgeon. He's a hepatobiliary surgeon, and you would never think of a surgeon actually sitting down with you. That was unknown.
But it has to be done, because they're the subject matter expert, and it's the patient that they're looking after at the end of the day who will benefit from that conversation. What are the laws that govern patient care, but now for children and adolescents? There's a reason I'm asking this. Or is it just it's the same across board?
So we are accredited by JCI, Joint Commission International. Accreditation is from the United States.
Right.
We just got a gold accreditation. We've had it. This is our third accreditation that we've got. It comes every 4 years.
Congratulations.
Thank you.
Yeah.
And JCIA is very, very strict. It has chapters. So when AI came out, this is the first time JCI had a chapter for us called HCT. And it was all about, how are you going to adopt AI? What are the securities you're putting in place, about teleradiology. So the same way, they have a chapter for also a pediatric, adolescents, mental health, all that. So we follow.
You're so passionate about this, and I love it. I'm like, I should have stayed in my NHS days a bit longer, but God always has other plans. Have you had other hospitals in the region call you up and say, Uzma and her team know what they're doing, we need this?
Yes.
Yeah. Yes.
Yeah, So yes, locally as well. The healthcare industry, especially now, and I'm actually really thankful to, DX Nova and CI100. They've actually got these IT professionals to come together. Yeah, and I think because of that, we are talking to one another. We're learning from one another. Of course, we're the only hospital right now that implemented this. So they call and be like, how did you do it? And, the joke is always okay, did you implement it? Is it okay? Is this vendor good? Should we go for it? So we do that. And I think the IT industry is really small here, but I think even going outside, I didn't know this, but when I'd gone for this trip to see different hospitals around the world, we'd gone to Turkey, and we'd gone to different hospitals, and we'd met the leadership. And one of the leaders messaged me when I got the DX Nova and messaged me and said, wow, you did it,
Yeah, and
so tell me, was it
Yeah.
easy? What were the challenges? Uzma, no way, you actually did. And I thought, oh my God, it's coming from somebody who has implemented an EHR and has read our story and, what we did. And so for her to ask me what were the challenges, it made me feel really happy. Like we've succeeded.
Oh, you're being humbled. She's a boss. She's a boss, everybody. Now, a few things before we wrap up.
Yeah.
Again, you're very passionate. Do you mentor? Do you offer internships for any young or somebody of my age listening to this podcast? How does one get into health tech? How should they get into health tech?
I love that question. Thank you.
Yeah,
I love mentorship.
Yeah, I know.
Our Khan University Hospital has got a really huge mentorship program because they saw the benefit and the value for not just us, but also the interns.
Yeah.
So yes, we do. We have a mentorship program so there are different types. So we have university students coming from out of the country. They come to learn our EHR, and see how did we implement? What are the lessons that they need to learn?
Yeah.
Because I feel like sometimes Africa is always just put on the side, but they need to know that, after implementing the EHR, I was really proud to say, as a Kenyan, we did this, And so we have that. And then we have local universities that we work with.
Okay.
And they, a lot with like the IT universities. So we have every quarter, we have their interns coming in. And it's really nice because, the leadership of their teachers or professors come and sit with us. And we actually now go through their rating and say, what did you think about him? And so we do that. Number 3, we have internships. You can come and apply.
Got it.
In health tech. And I always tell my interns that, it's a symbiotic relationship. You learn from us and we also learn from you.
Yeah.
And I feel like you shouldn't disregard that. They also come with something. Like I remember one of my interns came who now became a permanent employee. He created an amazing dashboard for us when it came to maternity and vaccinations.
Wow.
And so you see, when you give them that access, you give them the resources, you give them the knowledge because you're teaching them as well, right?
Yeah.
And I think that will really help our younger generation. Yeah. And again, women, I just feel like women, please don't fear coming into, even the interns, our men.
Yeah. It's we were having this conversation earlier and it's like, grab the bull by its horns and don't look back. And it sounds like that's what you've done with your life, and you don't look back. I've done it. You went, you did it, you conquered, you're still conquering. Yeah.
And 90% of the staff in my team are women.
Exactly.
Yeah. I just feel like we need to be appreciated. Actually, we don't even need anybody to appreciate us. We need to appreciate ourselves. And I feel like women don't understand that. They always say it's such a male-dominated field.
It will always be male-dominated.
It always will be. But you know what? I always say, get in the room, take your seat and own it. Yeah. And no one can take that seat from you. Yeah. No one.
Show up.
Yeah, show up.
Yeah.
And I think that's changing. I love it. I can see a lot of women coming out.
Okay.
And also again, when this DX Nova finalist, a lot of people messaged me on LinkedIn saying that we read your story, and we want to be like you. Fantastic. Was it difficult being a mother and being a wife? And so, Stella, I just feel like if you want to succeed as a woman, your support system needs to be very strong. So your husband, your family, they really need to support you. If you don't have that support, then I've seen it. It can be difficult.
And that we have God as well.
And God is... For me, I would have not done. I feel like my success and everything, it's God. There were miracles that He showed me, and honestly, there were times when I would sit there in the command center and cry, and we had a really small. I made a space in the command center, and it was our praying corner. So regardless of who you are, whatever religion you are, we used to pray. And I felt like, what? Can you imagine how many times whoever it is calling out their God in this certain room? This project is definitely going to be successful.
And it was successful.
And honestly, I feel like without God, I wouldn't have been here.
Amen.
Yeah.
I love that. Well, listeners, you heard it here first. God at the center of every tech transformation. And I've loved this interview with you, Uzma.
Thank you, Stella.
Thank you for championing patient care, patient rights, be it an elderly patient, a child, anybody. They will always know that Uzma has their heart in front of her mind.
Yeah.
But she does this because it creates impact. Thank you so much, Uzma.
I do, Stella, and I just feel like the one last thing I want to say is that, as a mother, you go through mum guilt. And my son and my daughter, I just always feel that. But when I look back, I remember my husband telling me once when we were implementing the EHR and I didn't come home for 4 days, and he looked at me and he said, Uzma, you know what? One day the kids are going to look up and say, that is my mummy. That's my mama. There was one project that I did, the Radiological Society of North America, when I went to present, and it was about women and mothers. Philips came with a prototype and told us that we have this small prototype. Mothers don't even know what ultrasound is when they're pregnant.
No.
So in the rural areas, and WHO says that you have to do at least one ultrasound. So they gave us a small VSEEK. It was a prototype. And I remember our chair, late Dr. Vinayak, said, go to rural areas and try to see how you can do this. Every hospital failed, but we made sure that we did it. And what we did was we had a tablet, we had the prototype, and we had a 3G modem.
And they had Uzma, please. And they had you.
Yes, Stella, you're so kind. Thank you. And we implemented this with the help of the clinicians, our radiologists. They trained the sonographers. Oh. Because you can't have a radiologist sitting in a rural area. Then it's not going to happen. Oh, so they trained the sonographers. Cost? Okay. Right? Of course, cost is the biggest. And of course, even like how many of them are here. Right? So we said, okay, train the sonographers. And within 25 minutes, we ensured that lossless images went from the rural area, whatever was being scanned, to our radiologists sitting in the hospital. They reported that and sent it back. And there was sentinel events that we actually saved. So there was like, the cord around the neck, just telling a patient that you're having twins, and they didn't know what this. Of course, there was a tab, like people were like, don't touch my stomach. What is this? Is it going to hurt me?
Of course.
And then, as you say, I don't talk much about it, but then I let it go. I was like, okay. And after that, I got an opportunity to submit our paper to Radiological Society of North America. And me and my co-lead, we went to Chicago. And Stella, I was 6 months pregnant, and I had I had a lot of complications. Oh. And I had to do an ultrasound every 2 days. And in my head, I'm thinking to myself, I have to go and present this, because I was the only hospital from East Africa presenting on that platform.
So you were flying the flag for your family, and for yourself, for the hospital, for the country, for the region.
And put Africa on the map. And my husband was like, go. You're going to be fine. And my doctor, I still remember Dr. Sekwarak just kept saying, Uzma, you can do it. And I'm thinking to myself, oh my God, with all these complications, but there was a reason. Yeah. So I was there heavily pregnant, and I presented this. And I remember I was on the same table like Mayo Clinic, Harvard University, and they all looked at us and they said, wow, is this what you did in Africa? And we're like, yes, And from there, the clinical team, they took it up and it moved it forward. And they went out and did this where Philips and Bill and Melinda Gates Foundation gave a grant. Wow. And now it's become massive, And because of this small project we started, going forward, the clinicians have also helped the Ministry of Health create guidelines for POCUS, which is point of ultrasound for gynecology.
The power of a mustard seed. Looks small.
Just a small. And honestly, it was so tiny. We didn't think. And today they're running it, and they've done, there's Mimba Yangu and iMama, and they're just,
that's where it started.
Yeah, so it started from a small little project that was VSEEK, and we were told to just go and try it out. Yeah. And that prototype VSEEK that Philips gave us to try actually went into production.
And it changed lives, saved babies, saved mothers.
And it's impacted. It's impacted. So, I may not be on the bedside. I'm not a clinician. I don't do surgeries. But, I know that whatever work we do, it's saving a life. So when I come home, Stella, I just feel like some sort of contentment that I don't have my mom and dad with me right now. They're my angels. But I know that, I feel like I wish I could save my mom. She had cancer. Yeah, but you know what? Yeah. When I do these small things, I feel like, today I feel so nice. I did this alert system, or I created this alert, or I did this. It saved a life.
The hero without scrubs. Changing lives. Oh my God. We should have an episode 2 looking at the future of patient care.
Yeah,
we'll have that.
It'll be very interesting.
Yeah. Once all these integrations are done.
Yes.
Yeah. Thank you.
So much.
Last words. Any last words?
I just want to say that, to the women out there, take your seat.
Yeah.
Own it.
Yeah.
And in healthcare, every implementation we do, every process flow we make, there's a human life behind it.
Yeah.
So when we succeed, there's just a sense of satisfaction that we get that is just you can't explain it.
Well, you've explained it.
Yeah.
And I hope our listeners will hear it when this episode drops. Thank you so much.
Thank you, Stella, for this opportunity.
No, thank you.
It's been a wonderful time with you.
Thank you. Thank you.